Welcome to the Empower Hour with Greater Nashua Mental Health. The Empower Hour will provide information and support about mental health, substance use, and behavioral health. Our goal is to share inspiring stories about transforming lives, to strike down stigma, and to encourage our community to reach out and get help when needed. Mental health is part of all of our lives. It's time we talk about it. I'm Dr. Cynthia Whitaker, President and CEO of Greater Nashua Mental Health, and it's time to get empowered. Hello, and welcome to the Empower Hour with Greater Nashua Mental Health. I'm Dr. Cynthia Whitaker, and I have the privilege of being the CEO at Greater Nashua Mental Health. We bring you this program to tell you about the things that we're doing at the Mental Health Center, as well as other topics related to mental health and the cool things that we do in collaboration with many of our partners throughout the community. Today, I'm excited to have with me Graham Thompson from St. Joseph's Hospital, and we're going to talk about some of the collaborative things we do together, as well as the great things that they do for our community. Welcome to the show, Graham.
Thank you. Thank you for having me.
So usually I just start with who are you? How long have you been with St. Joe's? What do you do there?
Yeah. So I've been at St. Joe's for about 3 years. I'm a director of our outpatient practices. So I work with our primary care, pediatrics, OBGYN, and our endocrinology group, as well as neonatology, which is who supports our birthing floor. So it's been really great. My background in healthcare, I've worked in Colorado, Utah, and a few hospitals here in New Hampshire. And I've really enjoyed working in healthcare and being able to help, those who are having a bad day, hopefully make it a little better.
And so you've been here the whole time we've started the reboot of the second attempt at working together in this project. Yeah. We had some conversations early on years ago when the state had an integrated initiative to create this project, and then flash forward a few years ago, we started meeting about how could we revitalize that idea. And I know what St. Joe's was really looking for help with at that point was pediatrics and youth mental health. So do you have, why did we choose that? What were you seeing in the pediatric practices that, you knew we needed to create this partnership?
Yeah, I think that's a great question. I think for pediatrics coming out of COVID, I think there was a lot of issues, the kids being home, being away from friends, and trying to navigate life. And I think we saw that really big impact on them as they were coming back to school. We were seeing an increased number of children coming with anxiety and, depression and other things coming into the practice. As well as, clinicians are primarily trained on the medical side of healthcare. And not that the mental health is not related to that medical side of it, but there's also an additional scope that they're learning. And so they're learning and growing with the population, but being able to have a resource that really understands the mental health side of that, whether it be through medications or through community activities and things that would help our children kind of grow and flourish. So that's why we wanted to start with pediatrics. It seemed like it was just shifting a lot, and the providers were saying that we need some help, and we were seeing it as well. And I think those that have children that we work with also were saying it too, so we recognized the need was growing.
Yeah, so kind of what I'm hearing is there's more wisdom together when we put mental health and behavioral health clinicians together with the physical health clinicians. It can benefit from that work together. So what we did was put one of our nurse practitioners able to support the pediatric staff. So what does that look like?
Yeah, so it's fantastic. So we get Chris comes into our clinic. She not only will she see patients, but she also is a great resource for our staff and our providers, which I think is really wonderful. Because a lot of our providers, they know enough and they love to go to her for a resource and say, here's what I'm thinking. Am I on track? What would you do? And she provides that resource. But we also have seen many families come through that are now having access that they couldn't find before. And so having them come through the doors and being able to see our patients leave and know that they're being really helped, that their needs that we saw before that we would send them out for are getting addressed at the clinic on site in a location where they're comfortable. And when you refer patients out, you also run into, will they go? Will they navigate that? Whereas when they're coming to the clinic that they already come to, it's a lot easier. They know the people, they know the staff. So a lot of the kids have a trust with our team. It's a great pediatric team. And we have 3 different offices in South Nashua, Nashua, and Milford. And all 3 offices refer patients to our Kinsley Street location, which is where Chris is located. In addition, we also have Hannah with us as well, who's really helped to help our patients navigate when they need resources outside of the clinic. So whether it's activities in the community or places where they might go to build self-confidence or whatever that underlying issue is, it's been great to have that there because our staff have been very appreciative as well as knowing what are those resources that are available.
So let's start with the nurse practitioner. So we have a psychiatric nurse practitioner, Chris, who comes to the Kinsley Street pediatric office, and those 3 different pediatric offices that you mentioned are kind of benefiting from having her there, and they can either ask questions for consultation, or they can refer a patient for her to do an evaluation on. Do you know what that looks like then when she's finished the evaluation?
Yeah, so I know when she finishes it, she will either continue to see them if that's the need of the child, or if she kind of assesses them and she kind of gets them on track, she can refer back to the primary care provider to follow that care. And again, they always have that window back to Chris if they need to, which is really great. Yeah,
and I suspect that probably early on people were more hesitant to take the patient back, right? Like, okay, you do it. But now, having her there, providing the consultation, maybe people starting to feel a little more comfortable with, oh, we can take this back. And how you mentioned sort of the comfortability people have coming to the clinic. I can imagine for a parent with a young child, the family's not needing to go to a different place. We're just going to the doctor like we usually do and going to see somebody different. And how comforting that must be for folks.
Yeah, and I think especially when you have a child that has anxiety, I would say I have a child that has anxiety, and it's a lot easier when it's a familiar space to be able to go in and have that confidence. I know who's going to see me, I know who's going to greet me. I may even have the same person that roomed me last time and put me in the room. When you're doing those evaluations, you get more comfortable with that. And I think it's a really great opportunity for our patients to have that access. And we're grateful to Greater National Mental Health for that partnership.
Yeah, it's for us, one of our pillars that we talk a lot about is empowering our community. And so this really matches that because we believe in kind of a public health type approach to mental health. That screening everyone for depression, anxiety is just as important as screening everyone for high blood pressure or diabetes. And this allows for that to happen. And for the providers to feel like, well, if they screen somebody and they screen positive, there's a next step other than just refer out and hope for the best.
Yeah. And I think especially when you know the timeline with, how soon they can get in, you have your team you can follow up with, where when it's an external referral, it's a little more challenging. You kind of have to, it depends a little bit on the parents, and as a staff, we can only do so much to get them in and to follow up with that. But this is much more controlled. And I think for the providers, that collaboration behind the scenes really makes a big difference for our patients.
Yeah, so a lot of positive impact to kids and families, and probably a lot of it we can't even quantify. I mean, like just the ease of navigating the system, the access, I mean, all of those things, so important. And then you mentioned Hannah. And so Hannah is there more as a behavioral health clinician, navigator, support, and making those connections to referrals and resources. So what's been some of the impact of that?
So I for us, it goes back to that once they leave that medical care and they've had that happen, it's done. But having Hannah then can say, great, we helped you in this, maybe there's a referral out there for that. But what organizations in the community will have something that will help whatever that specific issue that child is having. If it's anxiety, maybe you're looking for some empowerment. Maybe you're looking for some place they can build that confidence in a smaller setting. Or if it's, maybe it's grief related. What programs in the community have that? And again, as a medical provider, we know of a lot of them. But I think there's a lot more out there, especially when it's outside of the straight medical, right? You know, the Dartmouth or the Boston, the places where we refer, the Elliott. There's a whole other thing of local resources that we try to use, and as a good community steward partner, we try to do much like Greater National Mental Health is reaching out to those partners. Together we can do more, and so knowing we have Hannah there to help us know what those other programs are, and that reach for that child can become a little further, and hopefully help them along a little quicker, because obviously we want them to succeed, and that's really what we're truly striving for.
Yeah, one of the Greater National Mental Health staff described it as like live 211. Right, like because 211 in our community, people can dial 211 and get information on lots of resources. But that is what Greater National Mental Health staff do a lot of with folks that we work with, is connect them to other resources, like you said, whether it's for finances, housing, grief support, all kinds of things. And so for your staff to have that at the ready for a family can really make a difference.
Yeah, it really does. And I think we're healthcare, you know, years ago finally started to really recognize that those social determinants of health really have an impact on your health as a patient. And so being able to know that that patient has secure food, secure housing, and other things is really important for us. So know that those community partners are out there that are also working really hard to strive to ensure that everyone in Nashua is taken care of, or the greater Nashua area. Again, it puts us all working collaboratively and using those resources to the best of our ability, which I think is really something that Nashua does really well.
Have you heard of any like surprises or new connections that maybe your providers hadn't known about that we were able to help connect a kid to or a family to?
I think I would say the ones that I've heard of those success stories, is where they've just seen a child progress much faster, where maybe that child was having whether it's just true anxiety or I hate to say it, but thoughts of suicide or things. And then they get out there and then they come in and then they start to improve. And again, it takes some time, but we've been going with Chris long enough to start to see some of those success stories where patients you're like, they see Chris and you wonder how long will it take them. And then all of a sudden, next thing you know, they're kind of back with their primary care provider, and that they've found those community resources valuable. So it's been really, really great. And our providers are always asking, when, are we going to expand this, and when are we going to grow it? And then we also talked today, right before I came here, opening it up to some of our primary care providers that also see children, because they've been seeking this resource. We've kept it a little more limited to our pediatric practices, just to make sure that we didn't overwhelm Chris and we could get all the kinks worked out. But I think we're going to look to expand that so she can continue to help those providers as well, which will expand our reach at St. Joe's, but also that reach of mental health here in the community.
So when you say that, you mean like family medicine practitioners that might see the whole lifespan development rather than just pediatrics who see only youth. Yeah. So my understanding is we've supported cases as young as 7 months, meaning we've provided support and consultation around interventions for families, all the way to 20 years old at this point.
Yeah, and it's a wide range of patients that are in there. But I love it that every age is accepted, and everyone has a different need, and that care is made to the patient. But yeah, it's been really great to see that, and to see how fast the providers not only be thankful for Chris, but they're so grateful for Chris, and get those referrals going, and that feedback back to them. It's been really helpful for them.
The other thing you made me think about is kind of the continuum of care that we see, and so we're sort of in this middle of some youth have been identified by their primary care physician as needing some sort of something, and then they get an eval, and many going back to their primary care to monitor and maintain. But there are kids that we might then in that identify as maybe needing more intensive care. And I know that, we're also helping to support that transition so it's easier and folks aren't waiting, and they can transition right into care at the mental health center or somewhere else if that works for them. Yeah,
and that's been really powerful, having those established relationships that then can grow into other things. And again, there are patients that would need a higher level of care, but being able to know that those resources are out there, and where can we get them in the quickest, for the need that will benefit them, has been really fantastic.
Yeah, I can imagine just how powerful it is, right, when we're working together. When we were chatting before, I loved the analogy you used of one horse versus two horses, and what we can accomplish alone versus what we can accomplish together. I don't know if you want to share that, because I just love that.
It was a training we had last week, and it had, if you're a one horse on an average pull can do about 8,000 pounds, but if you put them together, it's 24,000 pounds. So they can pull 3 times that weight if they work together. And that's what I see a lot in our community partnerships, is we try to take them as far as we can. But when you have a partner that can address something, has an expertise, they can address it, how far we can really take those patients. And a few years ago, we did the Reach Out and Read program at our pediatric offices, which I felt like was a catalyst, where now patients, when they come in for their well child visits, they get to leave with a book. And we found that reading, builds a bond between the parent and the child. It's also a tool for the clinician to see, how does that child handle a book? What's their familiarity with it? But it also encourages that reading at home, which we know benefits our patients, and that helps their mental health as well. So that was a program that was launched. And I always feel like these programs, as we launch them, help us move into what's next. And I think then it was quickly moving back into that Greater National Mental Health program. And so to see these take off, and then you start to see the success stories. It really is great seeing that our future leaders are coming up in the world, and they're being taken care of, and those resources are available to them.
Yeah, I love that analogy of like the horse pull and what one horse can do, and how it's not just double when 2 horses come together. Because I think a lot of folks look to us as the mental health center to take care of everyone.
Yeah.
But we can't take care of everyone, because then we won't have the resource to take care of the folks who really, truly can only see us for the high level of care that we provide. But by partnering with you, as together, we can serve those folks in a different way than if you tried to serve them alone, or and it just really helps the whole community.
Yeah. And that's where I think we always call them like curbside visits, where the provider is touching base with like Chris. So in between a visit, if they can talk, it's amazing how much they can come up with a solution on a patient, versus having each person have to be seen by the provider and then by Chris. A lot of times the provider can see them and then do a side consult with Chris to see how she feels about it. And she might give them some guidance. Try this first. And then they work together. And I think that's really, you see that power, and we are able to help a lot more patients that way. And then again, Chris is always great, because if she feels like they're stable, they can come back to that primary care provider, and they still can be seen, get everything that they need. And if something happened again, she's right there.
Yeah, it really is amazing the fluidity that the teams have been able to create to make that happen.
Yeah.
I was just reminded of, if we go all the way back, before we were able to identify Chris as the nurse practitioner for the project, and as we were building, our psychiatrists, Dr. P and Dr. Connors, provided some just CEs, some continuing ed type of conversations for the providers to kind of launch the project, just general education about meds, and even them being available for some early on consults. And
I think that success was the building blocks to wanting to do more. And again, those providers will tell you having that medical background is wonderful. It's something that allows them to do so much. But this is a little bit different. And I think they feel comfortable handling a lot of it. But then you get to that next level, and you really want to make sure that you're doing right by that patient, especially when you're looking at medications or other resources, or, what are those resources to help the patient prior to medications? And they're always so good to talk about what they've seen and how this might work, and how would that benefit the patient? How might the patient react? Which has been fantastic.
Yeah, and I think it allows people to slow down and really do a more person-centered approach, which is, of course, something we really believe in the mental health field. But it's hard to do when you're moving so fast, or, you make a phone call to a provider that you've referred to, and you got to wait for them to call back. When you're right there, it really just makes it go so much faster.
And I would say, My wife works in healthcare, as do I, and so we know the patterns really well as to how healthcare works, how to do the referrals, how to get things in. But even for us, when we were navigating the mental health side of it, it could be a little bit more challenging to find out where to go, what to do. Where does your insurance want you to go? Who has access? What does that ability look like?
What's the right match for the patient?
Yeah, It's, especially when you're doing the therapy sessions, what does that look like? And so, again, I feel like that's where the power of this is it takes some of that guesswork out of it, where those patients can come to the same place, get the same thing done. But again, and then if they need something more, we help them navigate those resources and know who's available, who's in the community partnering with us, and what are they doing. And that, for us and for me, patient access and ability to seek care and get care is really, really important. I know it's important for St. Joe's. I know it's important for Greater National Mental Health. So knowing that we're partnering and making that happen has been a great opportunity to sit in the front row seat, and watch it happen. And see the relief. There's nothing like the relief of a parent when they are just, what do I do next? This is the person that I love, the person that means the most to me, and they're doing something that I can't really quite explain, and I don't know how to help them. And so I feel like it's, you really, when you see parents come in, you can see it on their face that they are kind of just, they're unsure of where to navigate and how to navigate. And then you see them, leave maybe the first visit, second or third, and all of a sudden you see a different level of confidence, a different level of, we can do this, we can get through this. And, I think they're feeling more confident that their child is, improving. And every child's different, but improvement will look different. But they're feeling much more confident that they're on the right path, and that they're supporting that child that they love so much.
Yeah, that seems like so important, because I think often, like, as folks in the healthcare system, it's easy for you to think about, just come here. It's easy to navigate our system. As somebody that's been in the mental health system for decades, it's easy to navigate our system, and yet it's not.
Yeah.
Right. And so by coming together, we know how to navigate our system, you know how to navigate your system, and we can help families navigate them both better. Yeah. Together.
And especially, I think, even with the social work side of it, ours know a lot of those resources, but knowing there's a whole other subset of resources that your team is much more familiar with, and then using those in the community to help us elevate as a group, I think has been really powerful to see.
And having sat with many clients personally myself, there's a difference between knowing a resource and having navigated that resource with somebody else before.
Yeah.
Right? Like, to say things like, the website's going to say this, and you probably want to do this, right? Because you have that experience, versus, well, it says this. Yeah. Good luck. Yep. Right. So I think that's by bringing the two teams together, we both have that depth of experience and can really support referring folks and families to where they need to go. Yep. Yeah.
It's been really, really great. And I think that's something that we both pride ourselves on.
Yeah. Yeah. So, and I know it's not the only place where we connect and collaborate, and it's not the only thing St. Joe's has going on. So what else would be interesting or to talk about?
Well, I think one of the things that I love is when I joined St. Joe's about 3 years ago, we have a senior behavioral health unit, which they had recognized the need in 2020, and they turned pretty quick to get it going. It's not meant for a long stay, but it's a short stay, average of 10 to 15 days. But to stabilize those patients that need some help and assistance. And I think that to me, when I was interviewing, they were sharing that is what they had done to get that going. And it showed that commitment they have to the community, that it was the right thing to do, that they really want patients and the families to be here, where they can see a patient, they can visit with them. And I feel like that really matched what when I came into healthcare, I really wanted to increase access. I feel like, as we talked about so far in the program, access can be really challenging. So how do we make access easy? And St. Joe's has done a tremendous job of increasing that access. We have patients now, if you're a new patient, you move to the community, you can be seen next day. You can make an appointment online and come in and see one of our providers. So we're trying to have access at all of our locations to make sure that patients that are out there that need to be seen, that they're not waiting. The longer you delay healthcare, whether it's screenings or other things, can lead to worse results. So for us, it's important to get patients in there, get them taken care of, get those screenings done or get something taken care of, and hopefully get them back on their way relatively quickly. But that's the commitment, and I see it every day at work, is that commitment level to the community on what does that need. We're talking always about where is that need. We look at a lot of data as well to see where patients are coming from. But again, seeing that primary care, we know that that's our front door, is getting patients in through primary care, and then they can be referred to our specialists, but making sure we have access to all of those stops so patients are not having to travel outside of the community if possible.
So it's what you've said about the access, and that you have access and people don't have to wait months to see a primary care physician or appointment if that's what they need, is very much like our open access, right? Like where we can help people with an eval, with those screenings, and then say, okay, things are okay. We actually can wait for a follow-up, or we get the screenings and that initially eval and visit and okay, we need to speed things up. So people aren't delaying to know, and that too can cause that relief we were talking about for folks.
I feel like healthcare is one of those things where we all have anxiety around. When you're not feeling well, it's hard to, life is hard. It's hard to live life, especially when you're not feeling well, or, if those are folks around you are depending on you, you take that serious. And so whenever you don't feel good or you're questioning something not feeling right, it's nice to be able to go and get those answers and move on with your life and have confidence that that was a non-issue, or if it was an issue, that you're seeing someone who will guide you through that process and see you out on the other side and make sure it's okay. So,
and for both systems, how much better to get that access at primary care, or as what we would call as an intake into our systems, instead of not being able to be seen and then needing to go to an emergency department because it's the only place you can get that answer for that anxiety.
Yeah. Especially typically lower cost of care, as well as being able to get in and you're not waiting. You're there. You're seeing that provider. That's one-on-one. They're going to spend that time with you, and as you mentioned, if it's something that needs more, they will spend more time with you, or they'll refer you to someone that they trust to take care of you.
And then back to the senior behavioral health unit, one of the things I love about that commitment that the hospital made was it's that specialty care here locally.
Yeah.
Because while we had that gap in our community for a while, where do folks get to go? They have to go outside. And so it's not only a commitment to access, but it's a commitment to local care.
Yeah. And that's one of the focuses that we talk a lot about, is trying to make sure that, and not everyone has that access, to a drive to Boston might be nothing for someone, but could be a lot for someone else to have to navigate buses and trains. And so whatever we can do to have that care local, it also takes a burden off the family, because then after work, you can stop in and you can see someone, say hi, check on them, which has been really nice. And healthcare post-COVID has been, I think, quite different than it was previous. COVID really launched a number of things and kind of threw things and made things crazy. And as we've kind of normalized coming outside of COVID, it's, I think, made that desire to have care locally at your facility even more important. We've also done virtual. A lot of places are doing virtual, which is a great way to help patients feel safe and comfortable when they're doing visits, because maybe their home's even more. So it's been some of those things that after COVID we've seen. So that's been another way to keep care local, or we've brought specialists in virtually as well. So I think that those are things that we've seen a big change in healthcare. But again, that commitment, I think, for both of us to make sure to try to do what we can, real time in helping patients is really key.
Yeah, that the access locally, and by working together to fill the gaps, because we can do more together than we could alone.
Yeah. I always say healthcare is a great place to be, but it's no secret that the funds are tight. A lot of it is funded through government and programs. And so being able to make sure that we can find those community partners that can help is really important. Because the more that each of us do, the further we can take the patient. And I think, and also there's those expertise and specialties that we rely on each other. So I think that that really helps benefit patients because it allows us to, all of us can then do more and try different programs to see if there's reach out there that will help patients.
Well, and the business side of it too. I mean, you just mentioned the funding. I think sometimes coming together, we understand there's things you as a provider can bill and do for, we can bill and do for, and we can get paid differently. So even based on a family's needs, depending upon where they get the services, depends upon how those services can be funded.
Yeah.
And so from not only a clinical care, but even a business practice, sometimes collaborations really make sense.
Yep, it does a lot. And I also think that our insurances drive a lot of where care is done. Typically, you can go be seen anywhere, but your insurance might tell you it's cheaper to go somewhere. So being able to build those partnerships, it allows us to also increase that reach for patients who are seeking care that maybe traditionally they couldn't go there because my insurance isn't there. But then in a partnership, a lot of times all of a sudden it's different and you can receive care someplace, which has really been something that's been great for our patients.
Yeah, exactly. And I think sometimes we, rightfully so, focus on the clinical side of the benefits of the collaboration, and we should, right? We should focus on that. But I think that the business case makes sense too. And a lot of times people don't think it does, right? Oh, we're doing this out of charity, or, well, no, it actually is both effective and efficient.
Yeah.
You know, for our families.
Yep. We always say mission and margin, right? Without a mission, without margin, you don't have a mission. So for us, you have to make those decisions that work. And I think that by finding those collaborations out there, that dollar can go a lot further.
Right. Just like we can pull more, right? We can do more with less when we work together, I think, as well.
Yeah.
Is there anything else exciting happening at St. Joe's you want to tell us about, or anything
always.
we haven't talked about that you want to make sure we chat on?
I think there's always great things happening at St. Joe's. Great things I love it. Our CEO is always encouraging us to be out in the community, trying to find partnerships, serve on local community boards and things, which is really great. They really try to do different things. We have a thrift store on Main Street that we started serving food at, dinner once a month, which has been really good. We all can take a moment to serve and say thank you to those that are out there and hopefully help provide a meal. We also have a program. We recognize that coming out of COVID, that a lot of patients, again, not patients, but a lot of our staff are also feeling that, the economy is really tough right now. Money doesn't go very far with our inflation and things. So we recognize that our staff are trying to fill the cups of our patients, but then they sometimes are feeling a little bit, they need their own cup filled. And so we looked at our EAP program, which is our employee assistance program, and realized that maybe there's something different out there. So they went out and we partnered with a company that does counseling for healthcare specific providers. And so if myself or one of my colleagues or one of the folks that work at St. Joe's is having a moment where they need to talk to someone, whether it's a personal thing or if they just had something bad happen at work and they want to talk to someone, you can make that phone call and talk to a counselor, which I think has been really powerful. Because I always say, I feel like healthcare is always a little different because you're always looking to give to someone else and fill up their cup and hopefully make them feel better. But that doesn't mean life's not happening to each of us as well. And sometimes you come to work and you try to leave home at the door, but there's times where it overflows. And so being able to know that there's resources out there, we've had some really great success stories. And again, it's not that we don't have partners here, but that's a more real-time one that we could address in those needs. And then again, folks can choose to remain with a counselor or look local, which has been really helpful for us. But I'm really impressed that they're always looking at that and trying to figure out how do we help our staff and our teams. And then I'll go back to, I think access is our big thing. It's just trying to make sure that our front doors are open, that patients feel that comfort level. And that, we work really hard on our quality metrics to make sure that patients, when they come, they're getting good care. It's challenging. There's a lot of moving parts in healthcare, as I'm sure you know.
Especially right now.
Being able to, keep all of those balls in the air while performing really well is something that we take pride in. But I love St. Joe's. They have a really great mission, a really great commitment to the community. And I'm always impressed by really working hard to do what's right in the community, which I think is pretty powerful. And, when we have these partnerships and collaborations, I love that it doesn't just stop with, great, it's working. Let's just not touch it. Always looking at like, what's next, or how do we grow this, and what does that need? Right. And I love that we still collaborate on that. And, us and our other community partners are also doing the same thing, which is constantly communicating and working together to ensure that, the patients remain in the front, but again, so does the team of folks that are providing that care.
Yeah, what strikes me from what you said is adaptability, right? So we're not check mark, we're done, but we're still looking for what are the gaps, and then how do we adapt to those? And I think that's really what nonprofits all have to do, instead of, well, this is what we do. Right? No, we have to pay attention to what the community needs and adapt and ebb and flow with our partners. And the other thing that you said that really strikes me is that care and concern for the employees, because we say the same thing, that, the analogy everybody's heard now, right, about putting your own oxygen mask on before you put on somebody else's, like they tell you on the airplane, is not only good on an airplane, but is good in life. Yeah. And I think many of our healthcare providers during COVID, whether it was physical health, mental health, all of us were trying to provide care from empty cups. And so that recognition post-COVID of just how important that is, I think for all of us has been important. So really delighted that you found a way to do that for yourself.
And I loved it. We had a large meeting, and our president kicked off a meeting. He had us each talk about how we fill our cups and get some ideas. But it was really interesting to kind of put your framework on and figure out what does that. What for me on the way to work is it that I'm thinking about or doing that will kind of create that passion inside of you, but also allow you to get to work and be excited to then take care of others. And it was a really good reflection opportunity, and it kind of challenged us all to see what is it that I'm doing, and then how can I help others. And I just thought it was a really interesting thing to have us all do together.
I mean, what a beautiful example of why we have this show, right? Yeah. The idea of empowering one another, right? And for us, we define being empowering as helping create, support the conditions for other people to thrive in. Yeah. And so sharing the ideas of what you do to help yourself, what I do to help myself, is empowering to anybody that can listen and helps, because we're not in it alone and we're not unique. As human beings, we all have anxieties, concerns, fears that we need to face every day, and how better to know we can do it together.
Yeah. Yep.
Yeah.
And I love it. And like I said, being a parent of someone that's been able to partake in the resources, it's been a really eye-opening for myself to also see the positive impact of what it's done for my family. And I think that's where I know if it's done it for my family, what it's done for others. And that's a very powerful thing to see and know that we're giving that back.
So what is one of those things you do to empower yourself or fill your own cup?
Yeah, so me, you'll hear, I always say I'm a dad and a husband first. That's my thing. And outside of an emergency, that's where I am. And so for me, it really is making sure that I find that time to spend quality time with the family. And so sometimes it's hard. You have different days with different hours, and you have a team that has needs, and you want to make sure you're there for them. But making sure during that week that we carve out time that's for us, that we're spending time together, and you're able to see them thrive and hopefully get beyond surviving into thriving as a family. And I feel like if that's going well, it's really easy at work to then do the other things. But
I love that. Yeah. So making time for what's most important in your life to then have that success trickle into other parts of your life.
It's really great.
That's a beautiful example of how one can empower themselves, is make sure they're making those time commitments to the most important thing. Yeah. Thanks for sharing that.
Yeah, thank you.
And thanks for being here.
Yeah, thank you. I've loved it, and I've loved our partnership, and I was so glad when you invited me.
Yeah, well, thank you so much for being here. And thank you for watching the Empower Hour with Greater Nashville Mental Health. We wish you an empowered day.